I'll start off with the first question and I'll direct it to Dr. Samuel Hansdak, who joins us from Muscat, Oman, and he's the president of the Indian Society of Lifestyle Medicine. So if you can go ahead and unmute yourself, Sam. I'd like you to give us a little bit of a background as to what this virus, what this infection is about. I know you and I talked about it, and you'd mentioned something really interesting. You mentioned the term immune resilience. And if you can just summarize in a very quick nutshell, what's going on all over the world and what is the basic biology behind why some people get really sick and others don't?
Good morning, good afternoon, good evening to all of you who have joined in. I know information is just overflowing and everybody of you would have researched about the virus and what it does. I will try to quickly summarize the same features that will be important for us and also trying to reflect what this COVID-19 is doing to us. Let's look at the virus just quickly. It's the smallest organism. It's so simple that even people have questioned whether it's a living or non-living. It has three components: the DNA RNA code covered by an envelope with these spike proteins, which is so popular these days. It has specific preference for a respiratory system, nose to lung. It enters into a cell and interestingly uses our body resources to multiply and then spread to others. It goes from a person to person, from home to home, district, states, countries, and lo and behold, now it's become a pandemic. Remember one fact, that this is a zoonotic disease, and as we look back into the history, most of our epidemics and pandemics have been zoonotic, jumping from one species to others, something to think about. And quickly about the differences, our body has mechanisms to control various diseases, be it infections or be it things like cancer. But few things I would want to bring up over here is our body's immune cells tries to protect us on one side, but on the other end, an excess response to anything that provokes it can potentially also harm us. And something to remember is what really kills us in COVID is the body's excess immune response that really kills us. So what is the most appropriate response, which as Pankaj mentioned is immunoresilience? It's not that we have low immunity, but it may not be the appropriate response to what is inflicting us, is where we are not able to protect us, or either we succumb to the disease or we succumb to the disease otherwise because of excess response. And those are some things that I hope today we'll be dealing with different topics, themes, and our different panelists. So I will just sum up in that form now.
Thank you for that, Sam. I had politely muted myself, and this is a good practice that whoever's not speaking stays on mute so that we don't create extra noise. So I'll ask you to mute yourself back, and we'll direct the next question to Cate. And we're going to jump right into this because we're talking to entrepreneurs, and this is not about the biology of the disease. As Sam gave us a really nice summary, we all sort of understand what's going on and have been reading the news and looking at the fancy pictures of the virus with pointy things coming out of it. But what's really exciting and should be exciting to entrepreneurs is that this has disrupted the healthcare system, at least here in the United States. And I'm hearing from my friends in India that there's a lot more telemedicine going on there as well. So I think it's all over the world. And it's led to a rapid adoption of digital health solutions and value-based care, where consumers are directly engaging in their own self-care, especially those who are over 60 because they're at a higher risk. And in my experience, we're realizing that people are now finding that they can do a lot more than just paying their bills remotely online. And they're actually talking to their doctors and getting care through video and telemedicine, which opens up a whole new area which had been unexplored. It's like, somebody said it recently, it was like an overnight solution that took 10 years, that was 10 years in the making, right? So what can we do to accelerate this forward? And how do entrepreneurs get excited, and what are some of the solutions that you're thinking might be possible in the next few months, years, Cate? Because I know you've been really involved already with some digital health solutions as it relates to lifestyle medicine.
Sure, thank you, and hello, everyone. So I couldn't agree with you more that COVID, I see COVID as a pandemic, an infectious pandemic within a chronic disease pandemic, and also an enormous opportunity. That's maybe not how we really want to think about it entirely, but I actually do think it's going to accelerate changes that have needed to happen for a long time. At least in the US, telemedicine has just been brewing and not really taking off. A lot of regulations around it. With all those regulations, coming down, we now, doctors have been hungry for it. Patients, I think, have been hungry for it. And it's really starting to happen. I think that will actually completely change the bricks and mortar institutions we've built. So I think the health institutions, the bricks and mortars are going to have to go through enormous change. Maybe we won't have as many showcase hospitals and clinics, and we'll really get down to the business of taking care of people without all the fanfare and the showcasing. But I also think, just as you've said, this idea of really letting digital health accelerate is really exciting. And so the entrepreneurs here, this is your time. And I think one of the barriers to that is I've seen it as I've used digital health in my lifestyle program, is there still is not a full engagement in terms of people really seeing the utility and really feeling it in their everyday life. So I think this is an opportunity to get past that obstacle, to get people the ease of use and the comfort level to come along. And so we really look at our behavioral psychologists and those that are doing work in the digital health field to really extend that even more. I also think that we have an enormous opportunity here in the food industry. I think our restaurants, our tourist industries, and everything have been financially impacted by this. And they've been financially impacted because we had this foundation of lifestyle-borne diseases. So we couldn't weather this infectious pandemic. And when we couldn't weather it, it took down a lot of the other, brought into effect a lot of the other financial impacts. So I do think we have an opportunity there to begin to talk about how do we actually foundationally make our people have fewer of these chronic diseases. We know how to do that. How can we turn on the lights and really get that done so that we can weather the next pandemic, the next novel coronavirus or novel virus that comes around the corner?
Thank you. Excellent. Yeah. So what you're saying is that there's a huge opportunity for digital health to move forward, and this should be an eye opener for us to really think about, what is it that makes this virus so dangerous? And for this, I'd like to go back to Dr. Sam to continue the conversation that he started talking about immune resilience and why some people may be at really high risk to go in the ICU, to die. We heard stories of people being turned away from the hospital because there weren't enough ventilators, for example, in northern Italy, and that's why we were so scared about flattening the curve. And there was a huge lockdown in India as well. So what are the host characteristics that determine who's going to get really sick and who isn't, Dr. Sam? And if I'm an entrepreneur, what should I be doing to make my immune system more resilient?
Thank you, Pankaj. If we just look at a quick statistics, in India, we have touched 90,000 cases. We have surpassed China. On the Asian side, our death rate is about 2,871, which is still lower than China. And the doubling rate has come down from 10.9 days to 13.9 days. when you look at the clinical profile, what we realize is different studies shows that up to 40% of the patients who are tested positive do not have symptoms. So most of the time we are screening for symptomatic patients. We check the temperature and any respiratory symptoms, we test them for COVID. But 40%, up to 40% can be asymptomatic. And among the symptomatic, we find that almost 81% have mild symptoms. About 14% can have severe, and about 5% can be critical. So that means about 5% would be very sick, and the case fatality rate is about 2.3%. Varies from country to country, but that's an approximate. So what you realize is almost 80 to 90%, even those who are symptomatic, would return back home. And it's among the very sick or the critical are the ones where deaths would happen. So that means our body still has an ability, even though we are infected, some of us may be asymptomatic, and those who are symptomatic, majority would return back home, and they would be, in one sense, immunized or protected. Replying to your questions as to who are the high risk, among the things that has been put together, as you mentioned, age. Again, different studies about 49 to 56 years of age seems to be at the highest risk. Obesity has been found to be one of the very strongest predictor of morbidity and mortality, a BMI more than 30. People who have comorbidities, that means those who have already having diseases, they have found that about 2.7 numbers of comorbidities on an average by various studies. And then fourth is smoking. So age, obesity, comorbidities, meaning having other diseases like diabetes, hypertension, heart disease, lung disease, kidney disease, other people at a higher risk, and smoking. So these are some of the risk factors which seems to predispose people to, one, become symptomatic, and two, the chances of death are also much higher among these groups of people. And these are again the paradigm of lifestyle. And so what should our entrepreneurs, not just them, but anyone should be taking care of is that, of course, you can't suddenly reduce your weight within this COVID time. Age is already fixed. And if you have comorbidities, it just means you need to take more care about your health, about your immune system, so that even if you are exposed to coronavirus, which most of them would in some point of time, because we won't be sitting home all the time. And so it's your immunity which is going to determine whether you get infected and whether you get sick.
Thank you. And if you don't mind muting yourself back, so this is really great. We're directing the conversation towards lifestyle medicine, and I think this would be a good place for you to jump in, Dr. Collings, if you can unmute. And the question would be, if I'm an entrepreneur or I'm a physician entrepreneur, which I would consider myself to be, what can I do right now, again, to save myself, A, which is what Dr. Sam was just talking about, but B, as a lifestyle medicine physician, entrepreneur, how can I take advantage of this very teachable moment where people are acutely aware that their lifestyle habits, as Dr. Sam mentioned, obesity, type 2 diabetes, heart disease, lung disease, smoking, these are modifiable, right? Yeah, he said you can't change your age and you can't lose 100 pounds overnight, but there are things that you can change rather quickly. And how do we take advantage of this pivotal moment and perhaps the most significant event in our lifetimes that we're all witnessing to make some changes for the better?
Yes, thank you. So yes, so lifestyle is really a powerful tool. Not just you can't, to the point that was taken, you can't change your diabetes necessarily overnight, but you can rapidly change diabetic control. It was a recent study reported in Cell Metabolism looking at, for instance, blood glucose control in diabetics. And diabetics with good blood pressure control had a 99% survival from COVID. And those with poor control, they just steadily went down, the poorer the control, into the 11% at the very, poor control of diabetes, 11% death rate. So you can rapidly change control of diabetes overnight, as an example. And we know that when we change in foods, for instance, to less inflammatory foods and to more foods that have the highest antioxidant and phytonutrient.
What do you mean by those foods that are anti-inflammatory with phytonutrients and antioxidants?
So those foods are in the plant category. So, it's close to nature, whole food, plant-based is where you're going to get all the vast majority of phytonutrients and antioxidants to not only support the immune system in, if you will, in the near term, but to also nourish the microbiome, where so much of our gut microbiome is where our immune cells derive from. So we can do this quite rapidly. We know we can change the microbiome, gut microbiome quite rapidly. We know we can change blood glucose quite rapidly with a change in food. And then when it comes to exercise, for instance, we know we can boost immunity right away with moderate exercise. 20 minutes of exercise can get an increase in the circulating immune cells for about 12 hours. So kind of coming back to every day, at least 20 minutes of exercise. So we know there's really real-time ways to boost immunity and real-time ways to turn around the clock on some of these chronic diseases, quite rapidly. So to the point of the index event or a pivotal event, people, to make this happen in the United States, people have this fierce autonomy, and they probably do everywhere, but I just know our country people don't like to be told to do anything. And yet, when people understood the value of masking, of social distancing, we were able to do it, right? People had to see its value, and they were able to do this self-care that affected not only themselves, but the collective good. What I hope will happen in this is that people will realize they are part of the larger solution. In other words, their self-care on other self-care things, how they eat, how they exercise, how they stress or don't, how they sleep, not only has an effect on them, it's not just making them feel better, but it actually has a collective good. When they're healthier, the pandemic's not going to be the next pandemic's not going to have such a high impact. Their job's not going to have as much of an impact. The domino effect won't be so profound. And so I think we really have to leverage that awareness, because it's almost like when people have a heart attack, they're open to change, in that you got to get them involved in that first week, and then it falls off. Life goes back to normal. We can't miss this event, this pivotal event, to talk to people about everything else about self-care, because it's also relevant even to COVID.
Yeah, we're getting a comment from somebody in the audience. Doug Amos says, it's clear that these viruses essentially come from domestication of animals for food, yet the media, at least in the US, is not bringing this up. In order to get in front of these challenges, how do we wake the people up to this problem so that we can reduce the risk in the future? Because it's true, this isn't the first pandemic, and it's probably not the last. So what can we do to really wake people up to the fact that this is coming from domestication of animals and eating animals? Whichever one wants you to take that question. You can unmute yourself. Whoever unmutes first.
Well, I don't exactly want to take that question because it's a hard one, right? But this pandemic is very much interwoven with climatic change and and that's related to the domestication of animals. It's very intertwined. It's very big. That's why, it's important to get across all these aspects to people before it actually all quiets down and everybody thinks they're getting comfortable again, and they're comfortable with the thought that a vaccine might be coming and so forth. But it is very multidimensional why this has happened. And it dives into some of the mishaps we've had in getting global awareness. And I'll say that the United States is a big part of it right now in terms of what we have to face. So, but I'd love to hear someone else's perspectives on that, because it's a difficult one.
Both from the medical and from a little philosophical point of view, is the whole understanding of lifestyle medicine is all about understanding the normal. Now we keep hearing the word new normal, and I guess lifestyle medicine is also to define a new normal, because somehow our normals have changed over years, which we think it's so normal. Lifestyle is questioning the very normal to say, is that really normal? So I guess even when we eat plant-based food, the moment we disturb the way it is normally packaged, we refine it, we process it, the health benefit of even the foods, the so-called foods from a good source, also gets affected, and we do not really get. So similarly, even, I mean, of course, the whole challenge about eating animal-based food, which is also, I mean, there's enough of studies to show the health benefits between an animal and plant-based food. Animals, if can be, I mean, domesticated in a sense, if you're keeping the animals and taking care of them, you don't really may have the issues. But then if you are using it as food, the way it is treated, the way animal is being bred, even in big countries, are something which is very sorry and sad to see those. So the moment we divert from the normal, we would expect problems. Things like vaccinations are something that we talk about. We do talk about interventions, the medical interventions and the drugs. All of them have its role to play. But you see, if you're really able to take care of our health the way that it should be, understanding what the near normal is, what is normal food, what is normal exercise, what is normal sleep, how do we look at nature, how are we able to inspire from nature and follow, I think that's where we start understanding this new normal. And almost every principle can be learned from nature to see and learn from it. So I would kind of philosophically put it in that sense. We can always dive into any specifics that people would like to answer. But COVID is teaching us few things. I would just put it in a quick nutshell, is that it is time for us to reflect. It is time for us to resolve, and it is time for us to react. So I think if we can use this time to think about in these three areas, I think when we get out of this lockdown, we should be a better and a more wiser people to make some important lifestyle decisions for ourselves and for our health.
Thank you. That was very eloquently put. And I love some of the pictures that are coming from different parts of the world of the water being so clear in the Ganges. And you can go outside and look at the night sky. And at least from where I am, we can see Venus very clearly and all the different constellations in the sky. I've heard that the water in the waterways in Venice is really clear. People have seen dolphins. It's just amazing to, just in a short amount of time, to have reversed so much damage that we had done just from human activities of essentially thinking that we can plunder and do whatever we want with other animals and also with the environment. And it's, in a sense, it's a blessing to see that impact of us not doing those things. Follow-up question to Dr. Collings. You mentioned 20 minutes of exercise can boost my immune system. As an entrepreneur, I'm less likely to get really sick if I'm exercising 20 minutes, but how do I do that when I'm afraid to go outside?
Well, I think that you've got, there's many different ways that people can exercise inside. I mean, an easy one is if you have some exercise equipment at home. But if you don't have exercise equipment at home, you can do body weight exercise. You can do stairs if you have stairs in your building. You can just be up and moving throughout an apartment. Now, in California, we do go outside and we do go out with masks on. And so, you know, we go out and it's easy to get exercise. but we do wear a mask when we're in close contact with other people. But certainly you can do body weight exercise, calisthenics inside, might be able to do jump roping inside, but you know, if you're in an apartment complex, you can do the stairs, and that all will count towards that.
Excellent. Thank you for that. We're getting a comment from Mr. Naren Bakshi from Jaipur, India. And he's asking if either of you can be more direct in saying that we need to reduce the use of animal-based food, such as meat, chicken, eggs, for health and for the environment. Can we be direct in saying that?
I can be direct in saying that. Yes. If you just want the question was, do we want to say that actually black and white? Yes, absolutely. Reducing animal products is going to be beneficial for the planet. It's going to be beneficial for human health all the way around. And that includes dairy.
Excellent. A couple of questions are coming in the webinar chat box. One is, as entrepreneurs, will medtech and agtech be the way forward to build practices on? And do cultivating plant-based foods make business sense in the emerging world?
Thank you, Pankaj. As Dr. Collins was talking about entrepreneur, and even when we look at IT, I mean, lately we have been also interacting with our friends in VIT Institute of Technology and exploring the things that we need to do. It was very interesting to see how they came up with so many ideas about PPE, about shields, and things that they said we could design it, we could make it, and we can do it right away. And many things we have always imported and got it from the usual known companies. But people were responding. Same here in Oman. PDO company were able to rope in people from the College of Engineering, and they were able to come up with some innovative solutions. I'll put it under three headings. Number one is clinical services. Number two is teaching and training. And number four is research. In clinical services, again, I said, what COVID is going to do is it is going to redefine the way we have done things in past. For example, for me, as I practice in CMC Vellore, we get patients from far off and they come to us for follow-up after 3 months or 4 months. Between that, what happens, we have absolutely no clue. There's no communications at all. And this is something that telemedicine could do, that you could actually be in touch with them much more frequently. We can monitor many parameters much more closely. We can advise them, we can educate them, we can do so many things in a more intimate interactions, and some things that we ourselves may not need to do. Even if we can build them good systems, the system can automatically give them feedback based on the parameters that they send it. So we can definitely improve the quality of care to our patients using technology. Education using technology, I mean, you just think about it. When I take a class for 50 students, I cannot peep into the mind who is awake, alert, listening to me, and they may be there sitting in the class, but not really being attentive. So, but when you use telemedicine, when you know that they are not there, you can have clickers, you can have interactions, you can make sure that you put some quizzes and everybody takes up that, make sure the attendance is there, and then people are listening to you. So suddenly you realize that distance education using technology and a well thought medical educational system can be much more intense and translate into more learning than our traditional classroom classes. And in terms of research, some of our colleagues from VIT has come up using artificial intelligence in our understanding of research. Even so much they said, there is a move towards taking a picture of a plate and calculating the nutritive values by programming things where you can do it as accurately as possible. And so I see there's a huge amount of prospects and opportunities that can come up when we start thinking out of the box, stop being the big man sitting in a seat as if the whole information of health lies with me and I deliver it, but we can humbly interact with as many people and do things much differently, which would be in a larger interest, beneficial for the patients and the community as a whole.
Excellent. We'll do one more question from the audience, and then we want to invite our host Mahavir Sharma to say a few words. And this is a good one from Paul Barinuevo, who's saying, based on studies, animal farming are the perfect incubator for viruses. And mainly they come from those environments. And we've seen this in many different pandemics that have come our way. And he's asking, is there any awareness in the medical community about that reality? He's talking about the medical community at large. Clearly, you two have very high awareness. But how do we take that to the rest of the medical community, I think is the question.
Well, as it always is, Panjak, it's people don't know what they don't know. And so it's really a matter of education, of connecting, the environment with medical care and understanding how our food is sourced and what the deforestation that happens from that and how that impacts our food sourcing and so forth. And I think it hasn't been brought into the medical communities widespread. I know at the American College of Lifestyle Medicine, our yearly event had Healthy People, Healthy Planet as a main theme about 3 years ago, when we brought in a lot of the information about this to raise awareness within the lifestyle medicine community. But we really need to branch out to the other specialties and to the general medical community for sure.
Thank you. And okay, one more question. Somebody's asking from Dr. S.K. Jain from Jaipur, India is asking, I guess it's directed to you, Dr. Collings, because he says, Madam, how is rapid control of diabetes possible? We need to protect the individual from this equilibrium type of situation. I think he's maybe talking about making the blood sugar drop too low too quickly. And how rapidly can you get somebody's diabetes under control if you're trying to do it now in this time of crisis where you're rapidly trying to make some change?
Well, I think the biggest thing is if the individual is going to make a rapid dietary change, really changing, everything they eat and, a full sweep, then you may need to monitor that individual very carefully, on a day-to-day basis. You may need to adjust their insulin prospectively. You may need to adjust their oral hypoglycemics prospectively. So it definitely, you don't want to put them into a hypoglycemic episode, but with careful follow-up. This is a beautiful example of where remote care monitoring and having people being able to tell you what their glucose is on a daily basis and have that easily accessible to the physician could really allow rapid changes in de-escalation of medications to happen, so that it's a safe environment for the patient.
Another question that comes to mind is, and this is for both of you or all three of you really, is how do we transition from lifestyle for wellness, right? It's good to talk about, oh, let's eat whole food plant-based diet, and you should exercise for 20 minutes, and you should meditate, and everybody should get to bed in time and sleep, and that's all good, and it feels good. How do we transition from lifestyle for wellness to actually treating and reversing disease, right? Because here we're in a really serious situation where we're talking about reversing somebody's diabetes or reversing their lung disease. So how do we bridge that gap, given that we're in this phenomenal, index moment in the history of mankind?
Thanks for the question, Pankaj. It was interesting as a part of my senior training fellowship of 12 weeks when I spent about a week in various lifestyle centers in North America, an 18-day program where patients with various ailments come and get admitted. And my experience, this was the first time I was ever visiting a lifestyle center. And within a week, when patients were able to leave all their medicines, be it diabetic or hypertensive, it was something which was amazing for me to see as a physician in practice for more than 10 years, to see actually people can stop medicine. And on 18th day, which was the last day, they have something, they call it as a graduation dinner, a candlelight dinner with one of the best foods served over there, where every participant would come up and give a testimony. Interestingly, no one was talking about the amount of weight they lost, that they stopped the medicines for blood pressures and sugars and all of them were normal. They were talking about how good they felt about being there, making friendship with people around, thanking the clinicians, not because of the clinical skills, but because of the compassion and care. And so personalized was their approach to them, is what they were talking about, noting addresses that we will stay in contact as they go home. So what it means to me is reversing disease is a byproduct when we see the greater meaning and purpose in life. And when that sinks to us, everything else becomes a normal consequence of that. So I think helping people to see the meaning and purpose in life, and putting the other things to say, when you do, these are the things that you need to do. And when you do it, the byproduct, the side effects are you will lose all your medications, you don't need to go to doctors, you don't have to pay bills. But really speaking, your main end is that you live life in a more holistic and a purpose-driven life. And I would see lifestyle from that perspective.
Very beautifully put. Thank you for that, Dr. Sam. And that brings up another point, which is that along with this pandemic, there's this epidemic of mental health problems, and depression and anxiety and suicides are up. People are stressed, they're not sleeping. I know in the first few weeks when it first started, I was having a hard time sleeping because you would get up at night and worry about it. And on top of that, we're asking them to distance themselves for others. And so how does loneliness play into all of this? And is there some connection between loneliness and or lack of connectedness to your immune system?
People have been questioning the term social distancing. It's not social distancing, it is physical distancing. But socially, actually, we have been more connected with many people whom we have not. I have connected with my batch. I have connected with my relatives on my mother's side, on my father's side. We do regular meetings and catching up with what they have been doing, something we never did it when life was busy. Suddenly we are so timeless and jobless that we don't know how to use time. But really speaking, on one side, we may be hearing of something adverse, but I would feel there's much more better things that is happening during COVID, and people should be sleeping better. Those who did not when work was very high would be eating and would also be conscious that we need to do a little walking, and now they have a time to do that, whether inside the house or going out of the home. So I would feel is that it's all depends on how we are seeing it and how we can help others see it.
Beautiful answer. And we have time for a couple more. Here's a nice one coming from Dr. Ramachandra from Fremont, and a really smart question, which is about the challenges that we are seeing. And he says that the response to the current pandemic is being politicized both in the US and in India. And evidence-based wellness initiatives are coming up against historic practices, cultural issues, and industry. How do we overcome this? In 30 seconds.
30 seconds, I would say find the right partners. There are other like-minded people. There's other organizations that have perspectives and are willing to go up against cultural issues, against industry issues. It's all in finding the collective, mass for that, and all work towards the same thing and form those partnerships. They're there in the United States. Everything you've said is absolutely correct. It's a very political situation, but there are pockets of hope, and pockets where people are, have been thinking even before COVID of what we needed to do in terms of our health. And so we just have to seize those and keep moving forward with those and look for more partnerships.
And Dr. Sam, what's your 30-second answer to that?
Somebody said he went to change the world, it did not. So he tried to change his country, it did not. He tried to change his state, it did not. He came to his family, they did not. So then he was very depressed, so he said what to do. So then something came in his mind to change himself. When he changed himself, his family changed. When the family changed, the community changed. When the community changed, the state, the country, and the world. So I think sometimes it is something for people to see in you, and you may be the message, rather than when we try to kind of use science to hit people hard on the head and tell them that they are wrong and we are right. Sometimes even that attitude can do more harm than good, as much as we have all the science. It's important that one, we make changes, but not just the physical, but we also need to understand people and care for them. And when anything you speak the truth in love, it does translate into the lives of people around you.
Beautifully said. Or as Gandhiji says, be the change that you want to see in the world, right? You be the change first. And we have another very poignant question, and we can probably close with this one. And again, you both have 30 seconds to solve all the problems in the world. And this is a complicated question too. It's, will values in life and valuations in business change in the coming world?
I think humans are humans, and we err and we quickly go back sometimes to the same mistakes. But I'm very optimistic that actually, Dr. Sam, some of the things that you said is actually people are maybe becoming more connected with other people. They're getting an awareness of working for a collective good. I don't think those go away altogether. I think people will find a comfort new normal, and it won't all stay there every day, but I think we are changed in terms of our values. I think that business, you know, there may be some businesses that there will also change on their value in how they honor their employees and how they treat their employees and where they want to go with their employee health. Now that could be, you know, for their own personal gain so that they have less financial impact down the road. But some of that allegiance between companies and their workers in the United States, I can say, you know, it's been quite different in the last 40 years. And maybe there will be a reinitiation of that, of companies really feeling like they need to take care of their employees and value their employees. So I'm optimistic. I'm always optimistic. I think good things will come of this.
Thanks, Cate, for that. And what I would add is I would like to use the words of Stephen Covey, what he writes in 7 Habits of Highly Effective People, is talking about character ethics and personality ethics. Sometimes we are moving towards quick fix. We want to project something which is not true inside, and that is what he defines as personality ethics. But the character ethics is when you change inside, the change will be seen outside, and you should be what you are inside, which should be shown outside. But the world is, they project something outside and it is not true inside. And sometimes people want to move fast and want to get things fast. Same as even with lifestyle, the changes takes time. It's a hard work. You have to persist, you have to pursue. And as Cate said, you need someone also along with you to help you. So as much as you make changes within yourself, realize that we as human beings are weak. We do have a low sides, and having a partner, having a group where you are accountable to, where you support each other, goes a long way to make these lifelong changing resolutions that we make in our life.